Hey, a very warm welcome to everyone. We are from HART Fertility Clinic. We're based at the world-renowned Christian Barnard Hospital in Cape Town's foreshore. We're a full-service fertility clinic offering all treatments from egg donation to IVF to sperm and egg donation. So this month is Reproductive Health Month during the month of February, and we'll be chatting to experts in the fertility field. In this episode of the Fertility Diaries, we are talking to our esteemed reproductive medicine specialist regarding endometriosis. We are also joined by our IVF and Surrogacy Coordinator, Sister Cyndi Nel, who will be answering all your questions regarding infertility and IVF. A warm welcome to both of you.
Morning.
Morning.
Cyndi, to introduce yourself, how long have you been at HART and what do you do?
So, hi everybody, I'm Cyndi Nel, as Kenny mentioned. I'm one of the IVF coordinators here at HART, and I've been in fertility for around 10 years now, and I absolutely love my job.
Dr. Farson, can you introduce yourself?
Hi, my name is Mark Farson. I'm a reproductive medicine specialist at HART Fertility. I joined HART Fertility in 2016, but I've been doing IVF since 2005.
Thank you. Dr. Farson, what is endometriosis?
There's a long answer and there's a short answer. It's not easy to summarize, but it's a chronic disease where tissue that resembles the endometrium grows inside the pelvis and slowly but steadily just keeps on growing and can, with time, invade neighboring organs. So endometriosis, in principle, is a benign disease. It's not a cancer, but it behaves actually like a sort of a cancer. The definition of benign disease is that it respects boundaries and it doesn't invade neighboring organs. But unfortunately, endometriosis is in its origin benign, but can grow into neighboring organs. So it can grow into the wall of the uterus, it can grow into the tubes, into the ovaries, into the bladder, into the abdominal wall, into the bowels, etc., etc. And by doing so, slowly but steadily, cause more and more damage. So the earlier it is diagnosed, the better it is.
Okay. What are the symptoms of endometriosis?
Typically, the ladies are complaining of period pains that over the years just gets worse and worse. And then slowly but steadily, the pain starts leading its own life. And then there will be more pain during the cycle. So not only during the menstruation, but during the cycle. And then eventually other activities as intercourse will also get very painful. And then finally, when it starts growing into neighboring organs, you get all sorts of side symptoms from those consequences.
Okay. How is it diagnosed?
So that's the difficulty. It's usually, in its beginning, it's a very silent disease. It doesn't cause many symptoms initially. And period pains, many women have period pains without endometriosis. So it's very difficult to make out the difference between innocent period pains and serious period pains due to endometriosis. And due to that, because it's initially a silent disease and many women learn that they have some sort of period pains and the parents often tell, that is part of being a woman, etc., etc. So there is a serious delay in diagnosis usually, due to the fact that the symptoms initially get ignored, and then with advancing time, the symptoms get worse and worse, and then finally a laparoscopy is done, and then it is diagnosed.
Okay, so can it also be diagnosed with a blood test or with an ultrasound scan?
Early endometriosis is very difficult to diagnose on an ultrasound scan. It is usually diagnosed based on the history of serious period pains that over the years gets worse, as I said earlier. Only very advanced endometriosis, when there are cysts on the ovaries full of endometriosis, that is diagnosed on the ultrasound or MRI scans. There's no simple blood test that can tell you whether it is endometriosis or not. is the hormonal test CA125, but it is not specific for endometriosis. So basically, there's no blood test, ultrasound only when advanced.
Okay, thank you. Sister Cyndi, what happens at a fertility assessment?
So fertility assessment is generally the first visit to see one of the reproductive medicine specialists. And during that consultation, the doctor takes an extensive history, based on or taking into account a lot of factors. And then a vaginal ultrasound is done. And sometimes, if the male partner, if applicable, has accompanied the patient, then the doctor would often also advise that he have a semen analysis done. But generally during the consult, it would be extensive history taking, like I said, and then the ultrasound.
Okay, so if someone is bringing their male partner for a fertility assessment, his part would be the semen analysis?
Yes, that's correct.
And is that done at the same appointment, or does he come in for the semen analysis at a later date?
This is just my personal feel, but I prefer that the patient actually has his semen analysis done before the consult with the doctor, because then that result can also be factored into the consult when they discuss the plan to move forward.
Okay, so that when the female partner comes for her fertility assessment, his results are also discussed
available
the way forward. Okay, that makes sense. And when should someone come in for a fertility assessment?
It's almost like Dr. Farson said, the earlier the better, with same with endometriosis. We feel that patients often leave a fertility assessment too late. But in general terms, according to the WHO, the cutoff would be when you've been trying to fall pregnant for about a year under the age of 35, and then above the age of 35 for 6 months. If you've been unsuccessful in achieving a pregnancy, it's generally when you should be thinking about coming to see a specialist.
Okay, so if I'm a young woman and I'm planning on putting off having children for 2 or 3 years, is it still worth coming to see a fertility specialist?
I think it is definitely still worth coming to see him, especially, I think the main thing for a female is to take her age into account. A lot of women at this stage, especially now in our age, is they are often career driven, or still want to have plans to travel, or a number of still trying to achieve various academic achievements in their life. So there are a lot of factors, but I feel that if you're not thinking about, or fertility is not on your radar yet, keep it in the back of your mind, but perhaps come in for the first assessment, just so that you have a baseline and you know exactly. The doctor can also then send you for a couple of blood tests, and it just, with all that information, just gives us an idea of where you are in your fertility at the moment, and sort of how much time you have left before we need to be concerned about your fertility. So
Okay.
then you can act proactive in terms of if you maybe want to think about banking your eggs, or fertility preservation on that end, or whether we have time to wait.
Okay, all right. Just from what you said earlier, it sounds like you advocate your partner attending the fertility assessment with you.
Yes, I always feel it takes two to make a baby. So I feel the support of a partner, be it male or female, is always greatly appreciated to the person who's actually coming in for the appointment.
Okay. What if we're a same-sex couple? Should we both attend?
Yes, so as well as that, also depending on the dynamic of the relationship, if you're a same-sex female couple and only one of you is interested in carrying the baby or going through the IVF process or artificial insemination, then it wouldn't be necessary that the other partner attend, but once again, for the emotional support, I feel it is beneficial. But then on the other end, if they're thinking about doing a cycle, what we call a reciprocal IVF cycle, where the one partner would go through the IVF process and then eggs are fertilized externally in our lab, and then the embryos are transferred to the second partner, obviously with psychological counseling and fertility law taken into account, with all of those boxes ticked. Then I think definitely, obviously, then both partners would then need to visit the doctor.
Okay. And how long are the semen analysis results valid for?
So semen analysis results in our clinic we would work on a year. I would say anything within a year we could still use. A lot of things change. So ideally you want to do the semen analysis as close to whatever treatment you are desiring to have it done.
Okay, that makes sense. Dr. Farson, can my gynecologist do a fertility assessment?
Oh yeah, absolutely. Every gynecologist can do a proper fertility assessment, and especially the baseline testing. It doesn't have to be a reproductive medicine specialist. The reproductive medicine specialist comes in when there are problems detected at the initial assessment, or if treatment is necessary. That's when the referral is required.
Okay. And Dr. Farson, while we have you, how does endometriosis affect fertility?
All right. So from my previous explanation, you may have understood then that endometriosis can be sometimes quite a nasty disease where it grows into surrounding organs. And by doing so, it can cause a lot of damage to the ovaries, the tubes, the uterus. And with the chronic inflammation and the adhesions and the scar tissue that it causes inside the pelvis, it can seriously jeopardize the chances of falling pregnant. So endometriosis needs to be tackled early and by the best possible person available, so that it can be addressed and it can be cleared up, and then subsequent to that, you can look at having babies.
Okay. How is endometriosis treated? You mentioned a laparoscopy earlier. What is that?
So there is no injection and there's no pill that can cure endometriosis, unfortunately. It's not an infection that is caused by bacteria or viruses that perhaps can be treated with chemical substances such as antibiotics or antivirals. There's no medication on the market to cure it. There is medication to suppress it temporarily, but it will not cure it. Now, first of all, the laparoscopy, where we look inside the uterus, inside the abdomen via the belly button, we can diagnose endometriosis, and then we can also remove endometriosis. So removal of endometriosis is the answer for the problem.
Okay, and once you've removed it, can it come back, or is it gone forever?
Unfortunately, it can come back. Yes, many women who are suffering with endometriosis have repeated laparoscopies, sometimes 2 or 3 years apart, sometimes even more often, to keep the disease under control. It is a sort of you can compare it like wheat in the garden. It grows under the surface and it keeps on growing. Unfortunately, the estrogen hormones produced by the ovaries every month by the growing eggs also makes the endometriosis grow. So it keeps on growing, unfortunately. But
Okay.
many ladies who will manage to fall pregnant actually will have a great benefit from the pregnancy, because the high levels of progesterone hormones during pregnancy will suppress the endometriosis for a long time to come.
Okay. And is it possible for someone to fall pregnant whilst they have endometriosis?
So in early stages, we classify endometriosis according to 4 stages: mild, moderate, severe. And in the early stages, it hasn't done too much of damage. Yes, it's very well possible that a spontaneous pregnancy can occur. Many ladies with stage 3 or 4 endometriosis will need assistance in the form of IVF to fall pregnant after that. So first surgery, clear up the endometriosis, and then either try by yourself, or if there is too much damage to the reproductive organs, then it will be IVF.
Okay. So you mentioned just now that endometriosis can come back. once I've had the surgery to remove it, how long do I have to fall pregnant before it could possibly come back?
It depends on the stage in which it was discovered. So early stage is easier to treat by laparoscopy, it's easier to remove, etc., etc. Once it has grown into all sorts of surrounding organs, it's actually, technically speaking, is not always easy to remove. And sometimes we have to leave some endometriosis behind when we do the laparoscopy because it is too advanced. So in early stages when you've managed to remove all the visible endometriosis, the endometriosis can easily stay away for 2 or 3 years, sometimes even longer.
Okay.
The more advanced endometriosis will probably never be cured. So it all depends on in what stage it was discovered in the first session.
Okay. And what's the recovery time on the surgery?
Usually, if the surgery is not too extensive, the ladies take a week off and are back at work. If it is a very advanced type of surgery where ureters have to be dissected out or a nodule in the bladder or part of the bowel had to be resected, then the recovery is a bit longer. So again, unfortunately, it depends on the stage of the endometriosis and the extent of the surgery.
Okay. Sister Cyndi, we've had some questions come through via email that if you could please assist us with them. How long is the IVF process from start to finish?
Okay, so the IVF process it takes about 2.5 to 3 weeks from beginning to completion. In that time frame, depending on where you are coming from, whether you're locally based in Cape Town or whether you're going to be traveling, we try to minimize your length of stay as much as possible, and we can minimize that by about a week. So if you're traveling into Cape Town, you would need to be in Cape Town for around 2 weeks. But if you're starting your process here with us, then it would be around 3 weeks that you need to counter for.
Okay. And what tests would I need to have been for to begin the IVF cycle?
So we would definitely recommend a fertility assessment with a reproductive medicine specialist. Once we have that baseline scan and his recommendation, we would then send you on for a panel of hormone tests, which include your day 2 or 3 FSH, your AMH level. Both of those are hormones, and your AMH is what we call anti-Müllerian hormone, and that gives us an indication of your ovarian reserve. And then we would also send you for prolactin, your thyroid function, and then in addition to that, your infectious disease screening that we need as part of our protocol for our lab. And that would include your HIV, your syphilis, your hepatitis B, hepatitis C, and then we also send our ladies for a rubella immunity to make sure that they're immune prior to transferring an embryo. Okay,
so both partners would need to go for these tests?
Both of them, minus the hormone test for the husband.
Okay, all right. And are all these tests done, it's a long list of tests, are they done in one visit or are they done in a staged manner?
Yes, they can all be done in one visit. If the specialist would like a specific day to be chosen to have especially the hormone testing done, then we can arrange that, but the rest of the tests can all be done on one day.
Okay, that's great. Can you ask for twins with IVF?
Quite a common question. We don't advocate, yes, you may ask for twins to answer the question, but as a fertility clinic, we don't advocate multiple pregnancies or multiple pregnancies. It's just that it's a high risk pregnancy. Not very often, but there can be dire consequences. Cerebral palsy being one of them, which is a horrific outcome for any outcome. We do, so we put back, ideally we put back one good quality embryo and to obtain a good healthy singleton pregnancy. At times you could place back 2 embryos, but this also doesn't increase your chances for success. It just increases your chances slightly for a twin pregnancy, which is not ideal.
Okay. And can you ask for a certain sex or choose the sex of your child?
So once again, you may ask, but it's strictly regulated in South Africa, and it's part of our legislation that we are not allowed to do sex selection for family balancing. So basically just to choose the gender, just because you have 2 boys and now you want a girl. It's only allowed if there's a genetic sex-linked condition that's prevalent that we need to check for.
Okay. Dr. Farson, how many days after the embryo transfer can I go for a pregnancy test?
When you transfer day 3 embryo, it's 12 days later. Day 5 embryo, it's 10 days later.
Okay. And is it a blood test or do I take a home pregnancy test?
Nah, we prefer a blood test to make sure that it is definitely true. A urine test is not that reliable. So we prefer a blood test.
Okay. Is there
it's a quantitative value that we test. So we will then be able to repeat it 48 hours later and make sure that it's increasing adequately.
Okay. Is there an age limit for IVF? Dr. Farson?
Oh, I see. Okay, I thought you were still talking to Cyndi. Sorry. There is, strictly speaking, no age limit. We won't refuse, but practically, we would strongly recommend not to look at IVF once you've passed the age of 42. Then the quality of the eggs has seriously been compromised, and as a result, the success rate of IVF will not be good. So preferably before the age of 40, in exceptional circumstances up to the age of 42, but not beyond.
Okay. And Dr. Farson, is there anything that I should avoid during my IVF cycle? Any activities that I should avoid or diet that I should take?
A normal healthy diet, use your common sense, lots of fruits and veggies and no fast food and that sort of stuff is good enough. Stay on a general supplement, a vitamin supplement, and avoid smoking and alcohol. That would be the principle. And for the rest, I would advise every couple to lead as much as they can a normal life.
Okay. And
exercising, if they are, then please, they must carry on with exercising, but nothing extreme. I wouldn't do a Cape Epic in preparation for an IVF cycle, but normal walking or cycling or swimming, that is perfect.
Okay. Sister Cyndi, what are the IVF treatment options for HIV positive patients?
Kenny, I think this is one for Dr. Farson.
Okay.
All right, so there are various circumstances possible, various scenarios. If we have a discordant couple where one of the partners is HIV positive and the other one not, then obviously normal natural intercourse may transfer disease to the negative partner, and therefore we have to assist. If the husband is HIV positive, we can then clean up the sperm, test it for HIV, and then use artificial insemination. If the female partner is HIV positive, then we can just do straightforward artificial insemination. If that doesn't work, then we can look at IVF.
Okay, that's great. So in closing, Sister Cyndi, how can one prepare to make the best outcome for their IVF cycle?
I think Dr. Farson covered quite a bit of it when he was talking about the diet and exercise. But I think, the emotional well-being of the couple is also very important. I think the couple need to support one another through this process. It's not an easy process to go through. So I think that's quite important to take into account. And then, just to lead a normal, healthy lifestyle, not doing anything too extreme on either end, and enjoying life as much as possible, while hoping for a little bundle.
Yes. Dr. Farson, any closing thoughts?
No, I want to just stress that early assessment of fertility, if there's any worries, after the age of 35, 6 months regular intercourse, which is 3 times per week, by the way. It wasn't mentioned before, so I'm just mentioning it.
Sorry.
But 6 months not pregnant and go for an assessment. And please, I would urge all couples, don't wait until you're 40 or 42 and then seek help, because then the chances of falling pregnant is seriously compromised and success is very low.
Okay. All right. Well, Dr. Farson, Sister Cyndi, thank you very much for your time. And thank you to everyone who's watching for joining us. Our contact details will be at the end of the video. As I said earlier, we are HART Fertility and we are based at Christian Barnard Memorial Hospital in Cape Town. We look forward to seeing you soon. Goodbye.
Thank you. Bye.
Bye.